Okay, so we're ready to roll. Let me close this screen. All right, so welcome and thank you all for joining us tonight. I'll be posting the recording on our website, naturalcompounder.com, in a couple of days. And we're repeating this again Monday night at 7 o'clock. Due to the high demand, all the seats sold out within hours of when the newsletter went out. We've since increased the seating and are running it twice. If you have any audio or video issues, just refresh your browser. That should clear up any issue. It's usually a browser or an internet issue. And there is a question and answer box. Please type in any questions there. We'll get to some of them at the end of this. And if we don't get to your question, you did see, you can call the store or email any of us, and we'll be more than happy to answer your questions. So tonight we're talking about recommendations for COVID that are science-based. There's a lot of information on the web. Some of it's good and some of it's not so good. COVID therapies are evolving daily. As we have more experience, there's more data to show what is helpful and what's not. Please be wary of posts that claim a magic bullet or this product protects everyone from COVID. There's no such thing. We are each unique, and the viruses have a way of exploiting our uniqueness, using those weaknesses. This is why some healthy people get very sick with COVID, and some health challenged people have a very mild case or don't get it at all. Lifestyle, health conditions, genetics are some of the factors that can contribute to our resistance to COVID and to our reaction to the virus if we do get it. There's research ongoing into treatments, preventive measures, and even looking for genetic susceptibilities. So what is not recommended today may be recommended soon. And what we think is the best therapy today may be proven not to be as effective or the best therapy. Also, due to each of us being unique, the therapy for each person must be individualized. We now realize this in the hospital setting. There isn't a protocol for COVID. Each person can be different. And that's one of the reasons we're doing a better job of supporting the very sick people in the hospital, and the death rate has gone down because we're having better outcomes than at the beginning of the pandemic, because we're realizing we have to look at this on a person-to-person basis. It's not one or two therapies fit everyone. And make sure if you're taking any supplements that they're quality products and don't contain any fillers or binders or colorings that could give you a problem. Feel free to call us at 781-893-3870, extension 3. The staff will be happy to answer your questions and help you with selection. And you can also email myself, Gary, or either of our functional nutritionists, Tamara or Alora, and they'll be happy to work with you to help you figure out what's right for you. We also offer well, they're not in person now, it's either on the phone or via Zoom, but personalized consultations. And you can reach us at naturalcompounder.com/our name, or go to the website, or even call the store and we can help with the booking. Okay, so here we go. There's a lot of information on the web about what to take, what works, what is and what is not science-based. The East Virginia Medical School published protocols that include supplements. It's science-based and is constantly being updated. It's a living document as new information is gathered, and it's based on their clinical experience. And these protocols are being used in a lot of the hospitals. They have a protocol to take prophylactically every day if you're not sick, to help prevent. They have a protocol if you have a mild case of COVID but you're not hospitalized, and they have protocols for all the different levels in hospital. They include vitamins and supplements and pharmaceuticals and behavior modification. Here's a link, the evms.edu www.covid.org/COVID care. There's a PDF there that the information I'm presenting tonight was extracted from. And at the very end of the PDF has all the references to all the clinical studies on everything that we're presenting tonight. And there's different treatment phases for COVID. There's the pre-exposure, so keeping yourself healthy and hopefully you don't get it. After you got exposed, but you may not have any symptoms, early treatment, and then the more severe treatments for people who are hospitalized. Here's two of the therapies. The top one's the prophylaxis. The EVMS is recommending these are good things to take to help support your immune system and hopefully lower your chance of getting COVID. The second one is the early patient protocols. This is the protocol for people who have COVID but aren't sick enough to be in the hospital. And as you can see, vitamin D3, vitamin C, quercetin, zinc, melatonin are all listed in the protocols for prophylaxis and early outpatient protocols. This does not mean you should stop doing what you normally do in cold and flu season. This is in addition, specifically for COVID, to your normal protocol. We still need to wash our hands, social distance, wear masks, well-fitting masks, eat well, get a good night's sleep, keep stress low. Stress really does a job and lowers our immunity. And exercise is very important. So this is from EVMS that they're talking about their protocol, ivermectin, which is on prescription, melatonin, as well as the combination of quercetin, vitamin C, may play an important role in both pre and post exposure. All of the medications they include in their protocols are inexpensive, safe, and widely available. So as I said a little earlier, there is no magic bullet for COVID. There's no single drug or one therapy that's effective for everybody. And this is a very complex disease, and we need to look at each individual separately. Our genetics, our epigenetics, pre-existing conditions, and lifestyle make each case different. Some people will have a cytokine storm and may wind up on a respirator. Some get no symptoms. Some feel like they just have a mild cold or the flu. And some become long haulers and have effects from COVID for months. Each case needs to be looked at as an individual with COVID, not a COVID case. Each protocol needs to be personalized for each person, their symptoms and their progression. Something that is probably a very good thing to have at home is a pulse oximeter. Now, the reason for this is the lungs are one of the big places where COVID attacks and where people have problems. We remember at the early stages of the pandemic, people were needing huge amounts of people were needing respirators, and we didn't have enough of them. And that's because the lungs can be affected, and it's where you've probably heard of the cytokine storm can have a devastating effect. So if anyone has any breathing issues, if they're not sure if they've contracted COVID, but they're starting to have a cough or they're starting to find they're a little short of breath, checking your oxygen level with an oximeter right away can be very helpful and could be life-saving. The data that's been accumulated shows that for just basic walking around, your blood oxygen level shouldn't be below 94. The people who, if they get up to walk into the kitchen and they get short of breath and their oxygen level drops below 94, they should call their doctor and get to the hospital. They found that people whose oxygen keeps dipping below 94 statistically have a greater chance of a serious lung problem and getting on a ventilator. Here's EVMS's recommendations for people with mild symptoms but are able to be at home. And so we'll go with the things you can get over the counter. Vitamin C, 500 milligrams twice a day, and quercetin, 250 to 500 milligrams twice a day. Zinc, 75 to 100 milligrams every day. Melatonin, 10 milligrams at night. Vitamin D3, 2 to 4,000 units a day. And this might be a surprise to some people, but a baby aspirin to an adult aspirin, unless it's contraindicated for you specifically. Aspirin has anti-inflammatory, anti-thrombotic, which is anti-clots, and it helps modulate the immune system, and it has some antiviral effects, and they found this is very, very helpful. Platelet activation plays a major role in causing clots, and we're finding both in the brain and in lungs that clotting is an issue. Having very microscopic small clots seems to be something that's very common with COVID. So now we'll go into each of the nutrients and some of the science behind that. Vitamin D3 levels important, and a lot of you that had your levels checked probably noticed that the labs have a range of usually 25 to 100, and if you're at 26 or 30, the computer says you're fine. You really want, the studies are showing, you really want to be up around 60. Vitamin D insufficiency has been associated with an increased risk of getting COVID and from dying from COVID. Vitamin D supplementation may therefore prove to be an effective and cheap intervention to lessen the impact of this disease. Now, it's likely the greatest benefit of vitamin D is for people who are very, very low. As they take it, they have better protection. And residents in long-term care facilities who took vitamin D supplementation statistically had a much lower risk of dying from COVID. The former CDC chief, Dr. Tom Frieden, stated coronavirus infection risk may be reduced with vitamin D. And this is right from the CDC about a vitamin. Linus Pauling with vitamin C proved the benefits of vitamin C a long, long time ago. And it works in many ways. It has anti-inflammatory activity. It's an antioxidant. It enhances the immune properties, including increased synthesis of type 1 interferons. And quercetin has a direct virucidal property against a range of viruses, including the SARS-CoV virus, and is a potent antioxidant and an anti-inflammatory agent. Melatonin, we think of as people take it if they have trouble sleeping to help with sleep, and that's true. But the studies have shown that it has a positive effect on our immune system in relationship to COVID. It has anti-inflammatory, antioxidants, immunomodulating, and metabolic effects that are likely very important in the mitigation of COVID. And an interesting statistic, it's intriguing to recognize that bats, which is the natural reservoir of COVID-19, have an exceptionally high level of melatonin, which may protect these animals from developing symptomatic disease. So bats are a carrier, but they don't suffer from COVID. Zinc is very important, not only to our immune system, but it's also a cofactor in many metabolic reactions in our body. It's a cofactor for an enzyme that fights against the SARS-CoV virus. It supports our innate and adaptive immunity, which I'll talk about in a few slides. And the suggested doses seem to be 30 to 50 milligrams of elemental zinc. B complex, very important also. There are many references I put up here, and they're at the end of the PDF at evms.com for the benefit of the B vitamins. We use more B vitamins when we're mentally stressed or the body is stressed. They're critical in many metabolic pathways necessary for a healthy body, and they're necessary for immune system function. They're necessary for detoxing, methylation, and many other metabolic pathways we need to be healthy, or if our system is under attack, to fight back. Now, something to be aware of, and with treating COVID, they weren't sure at the beginning, but now we have a lot of data to support these facts. Oral or inhaled corticosteroids. So a lot of the asthma inhalers that use steroids in the early symptomatic phase of COVID, which is when the virus is getting into our cells and replicating, they feel increases virus replication and the disease severity. So oral or inhaled steroids should only be used after checking with your doctor if you think you may have COVID. And there was an analysis in patients with COVID-19, and there was a higher risk of death of people with COPD and asthmatic patients using high doses of inhaled corticosteroids. So they have better treatment if you're having trouble breathing. With asthma, we just give a lot of steroids, but in COVID, a lot of times that can be counterproductive. So now we'll talk a little bit about the immune system. Everyone's immune system is different, but as a rule, it becomes stronger during adulthood, as by this time we've been exposed to more pathogens and develop more immunity. This is why teens and adults tend to get sick less often than children. Once an antibody has been produced, a copy remains in the body, so if the same infecting agent, antigen, appears again, it can be dealt with rapidly. This explains why some diseases, such as chickenpox, you only get once, as the body has a chickenpox antibody stored, ready and waiting to destroy chickenpox if you get exposed again. And this is your immunity. Immunity can be broken down into your innate or acquired immunity, and then acquired gets broken down into active and passive. We're born with our innate immune system. It provides a general defense against common pathogens, which is why it's also known as the non-specific immune system. It's the rapid response system, and it's the first to respond when an invader is identified. The cells of the innate immune system surround and engulf the invader. The invader is killed inside the immune system cells, and these cells are called phagocytes. The adaptive immune system can target specific threats against viruses and bacteria. The body has, I'm sorry, I put a comma in there at the wrong time. The adaptive immune system can target specific threats against viruses and bacteria the body has previously been in contact with. To help from the innate immune system, it produces antibodies after the body has been exposed to the invader. It can take several days for antibodies to develop, but after the first exposure, the immune system will recognize the invader and defend against it more rapidly. The adaptive immune system changes throughout your life. And then the passive immunity is borrowed from another source, but it doesn't last indefinitely. For instance, a baby receives antibodies from the mother through the placenta before birth and in breast milk following birth. This passive immune protects the baby from some infections during the early years of their life. So knowledge is constantly changing. In February, March, we thought that taking an ACE inhibitor was dangerous for people with COVID. Now with more data and more research, they realize in some people, ACE inhibitors can be helpful. Now again, this isn't for everyone. It's a case-by-case decision depending upon the person and their symptoms. COVID-19 binds to the ACE2 receptor on platelets, and they feel this is leading to an increase of blood clots in some people with COVID. COVID also binds to the ACE2 enzyme, which then can lead to more inflammation and increased cytokines, leading to the cytokine storm. And the cytokine storm causes the inflammation in the lungs. People can't get a full breath of air, their oxygen level goes down, and that starts leading to heart problems. So it's very interesting as time goes on, we're finding some things that we thought weren't effective are very effective and vice versa. Another issue is the growing number of post-COVID syndrome long haulers. And finding there seems to be more and more of these that we're hearing about. People after COVID, when they aren't suffering from the acute infection, they still have severe headaches, they're exhausted, painful joints, shortness of breath, chest pains, cognitive functions, and they're finding up to 50% of patients become long haulers. The post-COVID syndrome seems to persist for months, even after the acute infection is gone. And over half the people report a reduced quality of life. And they think it might have something to do with some of the blood clotting that was going on. And, this is the real bad thing. You make it through COVID, and according to the statistics here, about half the people don't bounce back right away. So you really want to work on prevention. That isn't an absolute statement that you won't get it if you do everything right. But if you don't do what you should do, you have a much greater chance of getting COVID. Now, misinformation on the coronavirus is probably the most contagious thing about it. That was from the director of the World Health Organization. The panic and misinformation spread by social media, it travels faster than the pandemic itself. So what can you do about it? Well, one, don't live on social media. Excess social media exposure increases the likelihood that you'll get more and more anxious, and depression is going up. Read news and information from reliable sources. And remember, take everything with a grain of salt. What you see online or in a newspaper or posted somewhere may not be true. If somebody probably isn't trying to put out bad information, but the information needs to be checked. People share false claims about COVID partly because they simply fail to think sufficiently about whether or not the content is accurate before they share it. And we've all seen once something gets out on Facebook or Twitter, it can take on a life of its own. Try to stay connected with positive thinking people, but do it remotely, not face to face. Have a plan for staying in touch with family and friends. We need that social contact. Identify positive thinkers and influencers. Limit contact with worriers. Isolation can cause ruminating thoughts and anxiety to explode. So use Zoom, the telephone, just be in touch with people, maintain a positive sense of hope, humanity, and kindness towards others. And we're seeing that in the news, all the people that are out helping. And seek professional help if the anxiety gets to be more than what you think you can handle. And then work on the things, put your energy into what you can control to keep you and your loved ones safe. Wear a mask, and now they're even recommending double masking, mainly because that helps hold it tight around the face. Establish social distancing, stand or sit at least 6 feet away. Limit attendance at large gatherings, eliminate your contact with those who aren't feeling well. Don't go to work or school if you don't feel 100% well. Practice good self-care. Good sleep, a balanced diet, exercise, a little fresh air, going for a walk, mindfulness, meditation, relaxation activities. Very, very helpful mentally, but also physically and for the immune system. And wash your hands. Originally, when COVID came, people couldn't get enough hand sanitizer and soap, and everybody was washing the front and the backs and under the nails, and you're supposed to be sudsing up your hands for about at least 20 seconds and then rinse all the soap off. And now we're getting tired of it. So a lot of people are getting back to their old way of washing. You put a squirt of soap on, 2 seconds in the water, and then you're gone. So make sure washing hands and masks are one of the best preventatives of COVID. So the EVMS talked about a lot of products. There was quercetin, zinc. A lot of people have problems with zinc that it irritates the stomach. So getting a well-absorbed, easy to digest zinc is good. Products come in capsules and tablets and powder, like the vitamin C there. I have a couple pictures of vitamin D in capsules. We have it in tablets. It's in drops. And on the B complex, there's all types of B complex out there. And a lot of people have trouble methylating. Methylating is what we do to activate a lot of our nutrients and use a lot of our hormones and also detoxify. So while you're getting a B complex, you might as well get a methylated one. It's already been methylated. So it's in all the vitamins in there are in the active form. You don't have to have 12 bottles lined up. A lot of the better companies are putting together packages. The zinc complex is zinc and quercetin in the proper doses. This box on the left, so you don't have to go grab all different products off the shelf. It has a good quality vitamin C, D3, quercetin, and zinc. And the one on the right side, the immune active, it has quercetin and zinc and vitamin C and NAC. NAC is good if you're starting to have some of the lung issues. So there are many good quality supplements and many poor supplements. And all of us at Johnson's, we're there to help you with your selection of supplements, whether it be tablets, capsules, liquid powders. So stop in the store. You can call us 781-893-3870, extension 3, or you can email myself, Tamara, or Alora. And we're set up in the store to save for your safety. We also do have parking lot pickup. You can call in your order, and when you get to the store, if you give us a call, we'll be glad to bring it right out to your car. And again, Tamara, Alora, and I are there if you need more personalized help. So another question is, more and more people are getting their vaccinations. And so what can you do to help the body? Because some people, it's not a side effect, it's the body responding to the vaccine. But after the second shot, many people are starting to have symptoms. Usually it's for about 12 hours. Vaccine support, on the left, we've been carrying for years. A lot of parents give it to their kids when they're getting vaccinated. This supports you with the symptoms you get when you get a vaccine, the body aches, the lack of energy, the headache. And so what's recommended is you take a dose, it's 10 drops the day you're getting vaccinated, and then you can repeat it every 3 to 4 hours as you need it for symptoms. And that's been very helpful. A lot of doctors are reminding their patients, one, we should be well hydrated all the time, every single day of the year. But you don't want to get a vaccine if you're dehydrated. So getting a good, clean electrolyte mix, adding some to your water once or twice a day, and making sure you're well hydrated. Homeopathy has been very helpful. Gelsemium 30C. A lot of people, if you think about if you ever had the flu, sometimes you get over all the flu symptoms, but you just can't get your energy back. You can't get a full head of steam going. Gelsemium is very good for when you're tired after either a vaccine or being sick and can't get your energy back. Belladonna 30C, the homeopathic belladonna, very helpful for the high fever, usually have a red face, but the splitting, pounding headache. Luckily, not the vast majority of people who get vaccinated get that pounding headache, but some do, and belladonna homeopathically has been very, very helpful. Okay, so you got your vaccination for COVID. Now life is back to normal, right? Wrong. Unfortunately, Fortunately, we all want to see our parents, our grandparents, and give them a hug. We have we want to have our immediate family together for dinner. We want to go away on vacation. Our grandparents and great grandparents want to hold and kiss their grandkids and great grandkids that they haven't seen in over a year. We want to be more social and get back to our lives. But we need to remember at this point, when you get vaccinated, it offers you protection that they're saying 95% you won't get a serious case of COVID. You could get a minor case, but not a serious case. But you can be an asymptomatic carrier. So if you're with other vaccinated people, you could still get exposed. One of those people could be a carrier. You could then become a carrier and give it to one of your loved ones. You could infect your family and friends who have not been vaccinated. Hopefully, we'll figure this out going forward. Maybe there'll be a change in the vaccines, so then we won't be a carrier. But as of right now, it looks like we can be. Grandparents who are vaccinated can still give it to their family. So be smart. Wear masks, wash your hands, maintain social distancing, and avoid crowds. So vaccination is not a license to be able to stop everything, all these safety measures, and return back to life as we knew it. I saw this in the Sunday paper. Dr. Fauci was asked by a 91-year-old woman down in Florida if she and her 3 mahjong buddies could get after they get their second dose, can they get together to play mahjong after being isolated for over a year? They want company. They want to see their friends. And his answer was, at this point, he has to say no because he doesn't know for certain. He told them to keep their social distance, masks, and all the regular precautions. Now, the other side of that would be if these 4 women don't have any other family, don't see anyone else, and their only social contact is their other mahjong buddies, the other 3, it's almost like they're in their own pod. And so maybe then they could, but it's just too early to know. So clinical studies are now ongoing to see if the carrier who has been vaccinated has a higher or low viral load if they're exposed. Because if their load is extremely low, the odds of giving it to someone and someone getting infected is lower. But it's just too soon. We don't know that yet. And so that's the end. In a second, I'll get the PowerPoint off and I'll look to see if there's any questions and do that. John and Andy and all of us over at Johnson's want to thank you all very much for all your support throughout the years, but especially this last crazy year. So write this coupon code down, COVID-19. If you can use that in store, over the phone, or on our Shopify site at shopnaturalcompounder.com, and you'll receive 15% off one whole order, not one item, but your whole order is one per customer, one per person, and you can use that. We're going to leave it valid until the end of March, so you have plenty of time. And it's our way of saying thank you for all your support. Now, if you just give me a minute, let me hit a few buttons, and I will be right with you. Okay, and we have a couple of questions. Let's see. Given the structure is done via genetic instructions, can an unfriendly country get into those instructions and harm us? This is coming from friends who believe in conspiracy theories. I do not, but I don't know the scientific answer. Okay, so right now the 2 vaccines, and this is my thought on it, are messenger RNA. They get injected into the body. It's almost like you're injecting a computer code into your computer. to recognize a virus, so one of the virus scan programs. So once it knows what it's looking for, if the virus enters your computer, it's primed and ready, and it attacks it before it does damage. That's how these two vaccines that are approved now work. Theoretically, could somebody get into the manufacturing at all the Pfizer labs and change it and have it be not detected? There's probably, I don't know, I would say no, but it could happen. But that, for me, isn't on my worry list. Another question from Michael: if someone has very minor symptoms, is there a reliable test to know after symptoms have subsided if you have some residual immunity? They do have antibody testing they can do. It's not being done often, and I believe it's very expensive. They're also doing a lot of studies to see both someone who has COVID and someone who has the vaccine. They're following people and monitoring to see how long their antibody, their immunity levels stay up high. So we just started the vaccinations. It's going to take a little time to see. We can't know this a year out or 2 years out because that timeline hasn't happened yet, but they're working on that. Curious about your thoughts regarding vaccine for chronic Lyme sufferers. All right, that's something that each person that has a chronic condition needs to talk to their doctor about, because people, if your immune system is very, very low, sometimes it's hard to get a good reaction or a proper reaction to a vaccine. Someone with Lyme, sometimes they're so brittle that the slightest change in the body can push them over the edge for a while. What I think you should do with your doctor is weigh, and you should do this with everything you do, drugs, vaccines, weigh the benefits versus the risk. And right now, the vaccine, the benefit column is huge, and the risks from the vaccine for most people is much lower than the benefit of getting the vaccine. So I would discuss it with your doctor. Somebody asked, do you have a good balanced multiple vitamin? Yes, if you call the store or stop in, we have many of them, some vegetarian-based ones. We have them without fillers. We have a low dose multiple vitamin and high potency multiple vitamins. Do you still need extra B vitamins? I would say yes, because one, we're all under more stress and we use more B vitamins when we're stressed. And the EVMS has shown that the B vitamins are very helpful for our immune system. And somebody asked, what's ivermectin? That's for parasites, and that's on prescription. So that's something you'd have to discuss with your doctor. How can I get a copy of the PowerPoint? I got in late, and I'll have it on our website, naturalcompounder.com. And if you click on the blog button, hopefully within a day or two, it'll be posted up there, and it'll be there for a very long time. You'll be able to go back to it as often as you need to. I see that the Moderna vaccine contains polyethylene glycol. Is there anything to take or do to counter the negative effects of this preservative? All right, it's a small amount. They do need that in there. That's part of how they have the vaccine, the code, the DNA code in a fat globule, and the polyethylene glycol is part of that. So they were looking at what else they could use, but nothing was as effective. Looking at what's in these vaccines from Moderna and Johnson's, the amount of other things in there compared to all the vaccines we've been using for years is much, much smaller. There's only a few ingredients in each one. And unless you know you react to PEG, it doesn't seem to have been a problem. Somebody wrote, I come into the store, but now I want items shipped. Do you still have free shipping? Yes, we do. Any order $49 or more is free shipping. Is there a homeopathic equivalent to ivermectin? No. I'm sorry, to the best of my knowledge, no. If you have a mild case of COVID a few more months back and are negative when tested, is there any reason not to get vaccinated? Again, you need to talk to your doctor. We don't have that information. What they are finding, I know Johnson's latest studies on their vaccine showed that people who had COVID and got one vaccination shot had a lot of them had a higher antibody and protection level than people who got two shots. So that's one of the reasons why they're talking about maybe with Johnson's, for some people, one shot will be more than enough, which will free up more vaccines. But I think that's, again, you have to weigh the benefits and risk. Please clarify being a carrier. Does that mean you're a carrier because you got the shot? No. The carrier is if you were exposed to COVID, there's a lot of people who are asymptomatic. They have the virus in them. It's multiplying. They don't have any symptoms, but they're a breeding ground, almost like the bats. And then if they're coughing or you're kissing them, they can spread the virus to you and other people. So once you get the vaccine, you're not going to get a bad case of it, but you could become, if you get exposed to it, an asymptomatic carrier. So the reason I brought that up is that way it's very important for you to be wearing masks and social distancing, everyone. The vaccine right now, the big benefit is the odds of you getting very sick are virtually 5%. And so the odds of becoming a long hauler is 50%. So there seems to be a real benefit. If I have a strong immune system and take all the natural supplements, would you advise not taking a vaccine? I never get a flu shot and I never got the flu and I never get the flu vaccine. A lot of people feel that way. I haven't had a flu shot since high school, and because I have a good immune system, I don't get sick. When I do get sick, it's minor. COVID, this is just me talking about me. COVID really scares me because a large number of people can die or get chronically ill or have damage to their body. And the negative effects from the vaccine seem to be much lower than a lot of the vaccines that have been out for years. So I wouldn't advise anyone not to get the vaccine. I'm not advising everyone they have to get the vaccine. I'm saying you need to gather good information. The EVMS site I gave you has good science-based information. They're not promoting vaccine. They're not telling you not to get it, but they're showing what the science is. All right, somebody wrote, I've read articles that say this is not a vaccine by definition, but a genetic therapy. And I'll say that's probably true. It is a vaccine because of how we administer it, but it is putting some genetic code in to forewarn our body to be on the lookout for the COVID virus. So it can, when I talked about the different immunities, the problem with a lot of viruses, and especially COVID, it's very invasive. It gets into cells and starts replicating and spreading through our body. And that happens before our body even knows it's there. And so then what happens is it gets ahead of our immune system. So it's different than some of the others. My oxygen has been 97 to 98, and just now during this program I tested myself, my oxygen was lower. Okay, I hope I didn't cause that. But one of the things that happens is when we sit down or when we're sleeping, we start breathing more shallow. And when we're looking at the computer, you've probably heard dry eye is a big issue because people don't blink as often when they're looking at a screen. Same thing when you're watching a screen, your respiration rate goes down. You don't breathe as deeply, and that can cause a drop in your oxygen level. Do you sell pulse oximeters at your store? Yes, we do. All right, somebody wrote, I have long haulers that I have long haulers that have continued since May. New long haul, but mostly short-term memory loss, unable to stay on task. And she was never hospitalized. Any suggestions on specific things that may help? This is from a young lady named Deb. Deb, that's a very personal, and like I said, the therapies are all individual because everyone's different. But feel free to email me at gary@naturalcompounder.com and we'll connect and see what we can do. What do I think about andrographis? I think it's a wonderful adaptogen, and that could be very helpful. The boron tubes, I would say use either a 12 or a 30C potency on the ones that were on the presentation. Do you think this vaccine could cause any harmful effects down the road? For example, Zantac causes cancer now. Well, one of the things with Zantac and cancer was it was contaminated in the tablet. I personally feel more comfortable with this vaccine because there's less junk in it, less excipients. And do we know what's going to be down the road? No. But with COVID, if you get COVID, we know of a lot of the terrible things that can happen, not just being hospitalized or on a respirator for days, weeks, or months, but there's over 500,000 people in the country that died. And so again, it's the benefit risk. Everything we do is a benefit risk. When you get in your car to drive to the supermarket, there is a chance somebody's going to run a red light and God forbid you could be hurt or killed. But we don't not drive to the supermarket. We keep our eyes open. We watch the other traffic and we make the best decision with the information we have. Thoughts on the J&J vaccine? Well, right now, I think it's still at a point where J&J and Moderna, if you're going to get vaccinated, whatever you can get sooner than later is the one to get. And do I recommend zinc and B complex daily for maintenance, even if not exposed to COVID? Zinc in general was recommended for people if they felt they were coming down or exposed to people who were sick to help boost the immune system. To be taking a larger amount of zinc all the time when there's no worry about getting sick, that probably isn't a good thing to be doing. Having some zinc in your multiple vitamin is a good idea. Now, another thing to think about is there's all different ratios of different minerals in the body. And so zinc and copper have to be at a certain ratio. So if you're taking a high dose of zinc for a very long period of time, that could throw that ratio off, and that can affect a lot of metabolic pathways. So that's something to talk to your practitioner or give us a call about. Let's see. My adult doctor got a COVID diagnosis on, my adult daughter got a COVID diagnosis on Christmas. She's past the acute phase, but has huge fatigue, no sleep changes, and it develops spells of shortness of breath on some evenings and was given an inhaler. I'm concerned listening to if this is best. If her doctor gave her the inhaler, then that's the proper therapy. The inhaler was when you're first exposed and the virus is in you replicating, the corticosteroids could increase that replication, but she's on the other end of it. So that could be, if it's right for her, a good therapy. Can the COVID vaccine possibly trigger a second autoimmune disease in individuals who already have one? I don't know, and it hasn't been around long enough to collect the data. Are there any reasons to take one of the vaccines versus the other? At this point, I would say no, because they both work and are basically the same. The Moderna at first was more readily available because it didn't need those special freezers to store it in, but now that's been addressed. If you could choose between them, which would you choose? I would choose the one I could get tomorrow as opposed to next month. Well, I talk about the vaccine support. How late to take before and after. If you call the store or look online, you can see all the homeopathics that are in there, the ingredient list. And what a lot of the docs and homeopaths are recommending is take a dose before you go get your shot that day. And then you take it up to every 3 to 4 hours, 10 drops, as long as you have symptoms. And what should happen, and what happens with a lot of people, is as they're using it, the symptoms start going down. And as the symptoms go down, you use it less often. When your symptoms are gone, you stop. What type of zinc is good? There's a bunch of them. There's reacted zinc, there's zinc glycinate, there's zinc citrate. And again, this is where if you email us or give a call to the store, they can help you decide. There's chewable, there's capsules and tablets. The same, I answered this, I think, do I prefer Moderna as opposed to Pfizer? No, I just think whatever you can get. My brother has rheumatoid arthritis. Is it recommended he take the vaccine? I can't say that that's something he should discuss with his doctor, but having arthritis isn't a contraindication for most people getting the vaccine. Will the store be offering the vaccine? Probably not, but who knows? There were a lot of pharmacies, the independent pharmacies, who were signed up to get the vaccine to help with the distribution of the shots. And recently, the governor has canceled a lot of those shipments, and they're opening up more state, the big state sites. So I think, it's probably going to be mainly the state sites, and then eventually it'll get down to the pharmacies. Okay, Tom Brady doesn't wear a mask and won't take the vaccine, saying his immune system is too strong to need this. I like Tom Brady. I personally wear a mask whenever I go out, and I think I have a pretty strong immune system. I don't think I've had the flu since high school. In the last probably 20 years, I might have had 4 or 5 sick days, but I take it. But again, this is a personal decision. You and your doc need to decide. Let's see, your opinion about giving the vaccine to a frail elderly with dementia, since there are so many reactions to the second shot. That's a tough one, but if they're frail and they're elderly, like with the nursing homes, we saw that they have a greater chance of getting COVID and getting very, very sick. So again, this is a discussion the family has to have with the person and with their doctor. I think about my neighbor who just missed the polio shot by 1 week when we were kids and ended up in an iron lung with polio. I think of her with the race to get the shot before you get COVID. That's, I'm old enough to remember some kids with polio also. It's very, very scary. And, we have to go with the science that we have and what we think is best. We have a couple more. As a long hauler who only recently started feeling better, I'm worried the vaccine may launch my immune system back into overdrive. Any thoughts? So, Marianne, again, all these type of things are very specific. Feel free to email me or give me a call at the store, and I'll be glad to chat with you. Any thought about which vaccine is least harmful? I would say they're probably about the same. I've used and continue to use many of the vitamins you mentioned in addition to herbs. I think they help me stay out of some of the most severe long hauler symptoms. I can't discuss my vaccine questions with my PCP because she doesn't think my experience with long haul COVID is real. says I have anxiety. That's another issue. Since a lot of this is new, long haulers are sometimes they thought, well, you just don't feel good, or you're a complainer, or you have depression. It was the same thing with Lyme, and the same thing with mold toxicity, and the same thing with fibromyalgia. And I remember back when I was in pharmacy school, a lot of docs were saying women who were going through menopause and having a hard time, it's all in their head. And so it might be time to find a new doctor. All right. And I think that answered all the questions that came in. Again, feel free to contact us at the store or email. My email is gary@naturalcompounder.com. And I'll get this up in the next couple days on naturalcompounder.com on the blog site. And don't forget to write down your coupon, the COVID-19, and that gives you 15% off one order. It's valid till the end of March, so you have plenty of time to figure out what you want to do, and you can use it in store, parking lot pickup, online, or if we ship something to you. And I want to thank you all so much for attending. I hope you found this helpful. Please get in touch with any of us at the store. We're there to help you, and we're there to support you. And again, we all want to thank you all for all of your support over the years and over this last crazy year. And together, we'll all get through this. So thank you very much and have a good evening.